Jim Gessner, President of the Massachusetts Medical Society, and I'm delighted to welcome you to the 5th Annual CARE Forum, sponsored by the Massachusetts Alliance for Communication and Resolution Following Medical Injury. Our society takes a particular pride in the Alliance and the work it's doing, as it was one of the original members and funders of this organization, principally due to the efforts of Dr. Alan Woodward, who is a past president of the Medical Society and past chairman of our Committee on Professional Liability. I have watched, listened, and learned a lot from Dr. Woodward over the years about this group's development since its very inception, as he reports frequently on it for us. He, along with Dr. Kenneth Sands, who was then Senior Vice President for Healthcare Quality at Beth Israel Deaconess Medical Center in Boston, began a research initiative which was funded by a grant from the Federal Agency for Healthcare Research and Quality as part of the President's Patient Safety and Medical Liability Program way back in 2010 to examine the feasibility of reforming the medical liability system in Massachusetts. They discovered that not only was it feasible, they succeeded in beginning to reform the system. And 7 years later, the reform continues. The creation of MACRMI and CARE, the CARE model of handling cases of avoidable medical harm, has been a remarkable step forward in the area of medical liability. Remarkable because MACRMI's efforts led to the adoption of medical malpractice reforms signed into law by then Governor Deval Patrick here in Massachusetts in 2012. Remarkable because the efforts have led to agreement among physicians and attorneys, something many thought would never before have been possible. And remarkable because the CARE model is based on two simple but very significant concepts: transparency and open and honest communication. And remarkable because the CARE model has demonstrated the ability to improve patient safety, reduce medical costs, enhance fairness in healthcare, support physicians in disclosure, and to avoid unnecessary lawsuits. What more could anyone ask for? This morning's session provided a background on the history of MACRMI and the process for implementing the CARE approach. This afternoon's session will offer new information, the results of a pilot study and the study of patient participants, along with a national perspective on this CARE approach. To begin the session, it is my pleasure to introduce Melinda Van Neel. Ms. Van Neel is Program Manager for the Alliance. She previously worked as Manager of Patient Safety at Beth Israel Deaconess Medical Center in the Department of Healthcare Quality, where she implemented one of the first CARE programs in our state. Melinda.
Dr. Gessner, and thank you all for attending. Before we get started, I just wanted to talk about your CME credits. These are the objectives, which you've seen already, and in your packet, there is some information about how you can get CME credits. You're actually just going to get a survey sent to you after this program, probably about 2 or 3 days. As long as you fill that out and send it back, you'll get a certificate, so that will work for CMEs and nursing credits as well. So if you have any questions, you could just let me know. All right. Great, so I'm going to talk to you a little bit today about what is new with MACRMI since the last time we had our forum. We're going to talk about some of the accomplishments and the resources, and we're also going to use our website today to just look at how you might use our resources for a case. For those of you that weren't here in the morning session, we are the Massachusetts Alliance for Communication and Resolution Following Medical Injury, or MACRMI. And communication, apology, or resolution, or CARE is how we refer to the process of how we resolve adverse events through this program. So, since 2016, we have been working very hard to complete our data analysis, and as Dr. Gessner mentioned, we will hear about that today. We are almost completed, but we have a lot of results to show you today. We had a 3-year pilot study at 6 different sites throughout Massachusetts, looking at different cases in the CARE program, both those where the standard of care was not met and caused significant harm, and those where the standard of care was met, but there was still communication barriers and other issues in those cases. We also grew our CARE suggested attorney list. So this was something we introduced last year. As we mentioned in our introductory session, one of the main tenets of communication, apology, and resolution in the resolution piece is that we want patients to be able to feel that they are getting a fair representation in this process. And so we want them to be have an attorney involved, if at all possible, especially when there's compensation involved. We want them to get a fair shake. And so what we did last year was we actually created a starting list. This is a MACRMI suggested attorney list. You can find this on our website. It's under the For Patients section. And since last year, we've grown it significantly. So there are attorneys both in the western and eastern and central parts of Massachusetts here. And we hope to add to this list as we grow this attorney community. So we're going to be having additional attorney seminars and additional trainings. Everyone who's on this list has attended a seminar that we have mentioned this morning. The Mass Bar Association hosted one. We had one in Hampden County. So if they attend that and then attest that they will follow the best practices that we also have online, then they are on this list. And so as we mentioned before, these are medical malpractice trained attorneys who also are informed about care. So we hope that you'll use this list. We also, in the last year, have had an article published on attorney representations, a similar issue, in the Healthcare Professional and Liability Review, which is on our website if you'd like to check that out. And very excitingly, we've added 3 new MACRMI members, Newton Wellesley Hospital, Brigham and Women's Hospital, and Brigham and Women's Faulkner. They will be launching, Newton Wellesley will be launching their program this summer, and Brigham to follow shortly after that, and as well as the Faulkners. So that's really exciting to have 3 new members since last year. And all of them are here today, so you can certainly feel free to talk to them about the process and how they like being at MACRMI. We also developed and updated resources since that time, so I'm going to show you what some of those are. The first is a guide to the insurer referral conversations. So this is something that actually last year this community voiced a need for. We needed some suggested language when meeting with a patient and believing that a case requires referral to an insurer. So this is a difficult conversation for many people. They feel that this is a time when you want to say to the patient, you know, things didn't go very well and we'd like to think about compensating you. We want to tell you what the next steps are, but this is a tricky conversation. And so what we did as MACRMI is we came up with a conversation guide to talk about this. And our first panel is actually going to talk about this conversation. The guide show you a little sample video of how that conversation could go. So we really hope that's going to be a helpful resource for you. It's in your packets. It's actually at the end, and also, of course, on our website. We also updated several resources. So we based some of the changes of these updates around feedback from patients who participated in CRPs. And our second panel today will actually talk about that research that Michelle Mello and her team did at Stanford. They interviewed patients who had gone through CRP or care programs and got feedback from them on how that went. And based on that feedback, we changed some of the way that our resources reflected that feedback so that we could make sure that we incorporated and were really listening to what some of the changes should be. And we really feel as MACRMI that that's part of our responsibility is we know that this care program works, but we want to continually improve it, and we want to make sure we're listening to the people that we're serving to make sure that it's working for them. So that's part of what we did. And so this is just a summary of what some of those changes are. The first is that we changed our first care algorithm that Evan had talked about in the morning session, defining a care case. It was very important to patients that they heard the results of patient safety improvements. And we found that in our algorithm, sometimes it wasn't quite clear when a case did actually met the standard of care and there was not significant harm, that we still needed to feed that back to the patient. So it was pretty easy in a system to say, okay, we didn't do what was right and that hurt the patient. Now we can make sure to tell them what we did to repair that. However, there's a lot of other improvements that happen even when you've met the standard of care or even when there wasn't significant harm that the patient wants to hear about. And so what we did was make that much more explicit in our algorithm to have that be its own step to make sure you tell the patient about those patient safety improvements. We also updated the templates for our patient safety procedures and communication policies, which we have online. So we have lots of these templates that you can use if you want to start up a program like this to not have to reinvent the wheel in your own institution. But one of the things that we heard from that feedback was to, as Alan also mentioned this morning, that patients want to hear directly from involved providers. So we changed some of the language to make sure that was an important part of that. That patients should be moved to private rooms, if at all possible, for all of these conversations about disclosure and what has gone wrong in this situation. And that written summaries of those discussions are helpful. So this is all feedback we've gotten from the patients. And so this is just a sample of some of the changes we made. So you can see that this is just part of the patient safety procedure, and so we've added language in there so that when you download these and use them at your own facility, they'll be more up to date and take into account that patient feedback. One of the other resources that we have online are templates for DPH serious reportable event letters that need to be sent to patients. And if you work in risk management here in Massachusetts, you'll know that you have a lot of these to send. And so we have language that's suggested for institutions that use a care approach so that they can use these to send them to those patients. However, one of the feedbacks that we heard from patients was that having risk management here on the header was very intimidating. And so we put some language here that says, if you can use names like patient safety, safety improvement, or something to that effect, that actually would be really helpful in having the patients be feeling that they can engage more and not be too nervous about getting those letters. And finally, we changed our implementation guide because of these results of that study. One of the things that we realized was that lots of people were not aware of the program. And so one of the things that I think Evan had emphasized this morning was we really need to continuously educate people about this. You're always having staff turnover, you're having lots and lots of different patients come in. And so you need to revisit the departments at least annually with an update about this so that you can continue to increase awareness, and that we should explicitly have a statement in here to add this into the new staff and physician curriculum. This is something that our pilot sites have been doing, but we didn't explicitly have that in the implementation guide. So that's something that feedback helped us to know was important. So those are the changes and updated resources that we have for this year. There is a list in your packet of all of the resources that MACRMI has created since we started, and it is extensive, but there is also a host of other resources on our website that we did not generate ourselves, such as articles or slides from other different programs, data from other areas in the country. And so you please feel free to go on our website and download and use any of those resources. They're all free, and they're all to help you start programs like this. One of the other things that we heard from you last year was that you'd like to sort of see how the website works and understand how you might use it for a case. So that's what I'm going to do now. So I'm just using an example of a patient. If a patient calls you and voices a concern about the care they've received, they say, for example, they were admitted to the hospital to resolve back pain that he had that was untreated after a surgery. So he's had a surgery at your place. He has had back pain since then, and it is untreated, and he wants a resolution. So how would you use the MACRMI resources to do this? We're going to go first to the MACRMI website so you can see where the resources page is. So when you get here, there's a lot of different sections for different types of people that might be engaged in this program. There's also a news section. But what we want to go to is the resource library. So this is where all of our resources are housed, right here. And the way that it's broken down is you can view a list of every single thing that we have, which is not probably the most efficient way to go through it, but you can. These are a list of our most commonly requested resources. And then we also can search by category. So you can see all of our best practices, for example, in one list, or you can look at all these different media coverage or anything else you might be looking for. And you can also search by keyword or phrase. So, for example, if you want to pull up the best practices, instead of using that category, you can do that and they'll all show up this way as well. However, we think that for using it for an actual case, our care timeline is really helpful. So this is on the front page, and it's also available to just pull up through the resource guide. And when you click on it, it's actually an interactive resource, which is really great. Oops. If I can show it here. Here it is. Okay. So this is the care timeline, and this is also in your packet, but it's meant to be an electronic resource. So here you are at the beginning of your event, and you, for example, need to talk to the patient to have a discussion about the error and the known facts. So these are the resources that MACRMI has in blue. And in green is the group that might want to use that resource. So, for example, let's say you need a sample communication policy. How do you talk to the patient? What kinds of things do you want to put in the record? These are some of our suggested resources that we have, but matched up to that timeline. Here are some of our best practices for interfacing with patients. So this is a nice way to see during a case each step that we have a resource for. So you can see you might finish that disclosures section, and then later you need to send an SRE template. We have 2 of those, so that brings you to a screen that opens up both of those different letters, and then you can download them over here. And so on and so on. And so this is a really nice way to take this case and look at our resources and make sure that you can use the things that we have already created for you, so you don't have to reinvent the wheel. You don't have to spend a lot of time coming up with a policy or a procedure or a template for something, and you can really focus on actually activating that program with patients. So this also has a section about how to set up a program. Like that slide had just said, you don't want to just use this for a single case. This is a program that's supposed to be throughout your hospital or throughout your facility, that has a baseline of culture of patient safety, that has a lot of other components of it. But if you're at that point where you feel like you have a transparent culture and you want to start doing this, we have an implementation guide and an implementation team that can help you. And then this is how you would use our website to use those resources. If you are thinking about implementing a program, we're happy to help you with that. We do have this implementation guide here that Alan had mentioned, which is also an interactive resource. So you click on the resource and it will take you to each of the things you need to implement this program at your hospital or your facility. All right. So, let's get to it right. Oh my goodness. This is what happens when we have all these browsers open over here. All right. There we go. Okay. There we are. All right, so there's a timeline. So that's in your packet. And as I said, all the resources are available on our website. And if you have suggestions for other resources, like I had just mentioned today, one of the resources we came up with this year was because of some suggestions that you had about things you needed help with. So if you do have some suggestions, please let us know in your evaluation. That'll be emailed to you because we really can work on them and help you to get what you need. So. Next, I'm going to introduce Alan Kachalia and Michelle Mello. They're going to talk to you about the care evaluation results. Are they in here? I was like,